I think there was a lot of people placed in the right place at the right time, and it wasn't my time to go yet, so I'm very fortunate to still be alive, very fortunate. I went to the gym that morning, and during the Zumba class, I had apparently told someone that I didn't feel good, and I was going to go get some water, and I walked out of the class and collapsed and went into cardiac arrest.
And had to be resuscitated by a paramedic who happened to be in the exercise facility and utilized an external defibrillator to resuscitate her.
I still have a hard time wrapping my head around the whole situation. When I think about it, I kind of get choked up, and it really kind of takes my breath away to think that I was standing 1 minute and the next minute I was collapsed.
So patients will have sudden abrupt arrhythmias, ventricular arrhythmias from the bottom part of the heart that are life-threatening because they immediately lead to circulatory collapse. The best protection for patients at high risk of these rhythms is to have an internal defibrillator that is there available that can detect these irregular rhythms immediately and act very rapidly to terminate these rhythms by delivering a shock internally to restore the normal heart rhythm.
Dr. Santucci said that I would be a candidate for this external defibrillator, which the leads don't actually go inside of the heart veins, they're placed outside.
There are some disadvantages to having wiring within the vascular system and within the heart, and so it's been a goal or an idea to try to provide protection of a defibrillator without having to place wires within the heart for some time. And now, recently, this has become a reality. So we now have a subcutaneous defibrillator, it's called, where we can get the function and protection of a defibrillator without having to place or leave wiring within the heart itself. With this type of a defibrillator, instead of placing the wiring within the heart, the wiring is placed under the skin in the chest area and attached to the generator, which is now placed just below the armpit.
It could happen again at any time, so it does. It makes it feel like there's a safe feeling to kind of, as like an extra security measure, that it can be there in case of an emergency. Absolutely.
How are you doing?
All right.
I wasn't expecting you. Here at Loyola, we're one of the premier treatment centers for heart rhythm disorders, and we're happy to have this opportunity to provide this device to complement our full option of treatments for patients with heart rhythm disorders.
I'm a mom of 2 small children. I have an 11-year-old and a 5-year-old, so I need to be active still for them. So this enables me to get back to normal life.
So it is gratifying to be able to help a patient like Stacey, who is a young woman, young, healthy, active woman in the prime of life, and who has a very serious heart problem that would otherwise place her in serious jeopardy. It really is a wonderful opportunity to be able to provide this kind of a device to her, which we couldn't have even done 5 or 10 years ago.
You guys have the best doctors, around. So I was in great hands. I have no problem that I didn't think anyone was going to take great care of me while I was here. Absolutely.